October is also Breast Cancer Awareness Month, and no matter who you are or where you live, you or someone you know has been affected by breast cancer.
Joining us now to talk about the disease and efforts to fight it is Dr. Alvaro Mendendez, breast cancer specialist with Hartford Healthcare. Thank you for joining us, Dr. Mendendez.
Thank you for having me.
Okay, as we come down to the close of 2023, what are some significant statistics about the disease and who is the most affected?
So all women are really affected by breast cancer. Connecticut is actually the second highest state with breast cancer diagnosis, but we are not actually at the top of the mortality because we get to diagnose them early. So we recommend breast cancer screening for all women age 40 or older, or those women who have a family history to start early on.
Doctor, this might sound like a funny question, but when we talk about raising awareness, what exactly do we mean? How can raising awareness help, and who needs to know what?
It's raising awareness not only of breast cancer and the fact that everybody, including myself, can be affected by it, but it's raising awareness also that there are very good screening or early detection methods, and that there is the ability to offer screening or early detection methods to every patient, regardless of where they come from, where they live, and all of the other socio-demographic factors that vary from patient to patient.
So you did mention that early detection is key, of course. What's the latest advice on women for breast cancer screenings?
So we are recommending that all women age 40 or older are getting yearly mammograms. Now we have tomosynthesis, which is a deeper look into the breast. For those women who have dense breast, we also recommend getting an ultrasound along with that mammogram, but mammogram continues to be the standard of care or the gold standard. Some patients will get recommended MRI depending if they have long family histories for breast cancer. And then those women who are less than 40 but do have a strong family history, they may actually start earlier, as soon as 25.
Wow.
And doctor, how do disparities and inequities in healthcare factor into breast cancer detection and treatment?
Yeah, the breast cancer impacts all women, regardless of where they come from. And we know that, for instance, African-American women get diagnosed with more aggressive forms of cancer and have a lower ability sometimes to tolerate chemotherapy because of their side effects. We also know that Hispanic women get diagnosed with more advanced stages of breast cancer because of their unwillingness, sometimes culturally or insurance-wise, to get mammograms. And so we are trying to make it so that every woman, again, regardless of where they come from, where they live in the state of Connecticut, they have access to free screening mammograms or standard of care, and then they all have equitable access to treatments and clinical trials.
All right. Dr. Alvaro Mendendez, breast cancer specialist with Hartford Healthcare. We appreciate your time today. Thanks for joining us.
Thank you.
Thank you.